Hello Health on LAE is presented by the Ochsner Health System, a nonprofit, academic, multi-specialty healthcare delivery system dedicated to patient care, research, and education. The Ochsner Health System includes 7 hospitals and more than 35 health centers located throughout Southeast Louisiana. Ochsner, healthcare with peace of mind.
I call it my I've got a healthier plan. With the Humana Medicare Advantage Health Plan, I get more health and wellness options like fitness programs, health management classes, and a 24-hour nurse line. I can even talk with a Humana MarketPoint representative whenever I need to.
More of what you want, because you deserve more.
Hi, I'm Tom Bagwell, and welcome to Hello Health. LAE is proud to be partnering with the Ochsner Health System and Humana to bring Ochsner's Hello Health weekly education and information series to television. Tonight, arthroscopic hip surgery, and our guest is orthopedic surgeon Misty Suri. Well, tonight's guest is a team physician for the New Orleans Hornets and the New Orleans Saints and the athletic programs at UNO, Loyola, Dillard, Xavier, and SUNO. He also works with several of the high school programs in our area. He is a graduate of Ben Franklin High School here in New Orleans. He studied pre-med at the University of Pennsylvania, where he played football, lightweight. We'll talk about that later. His bachelor's from there is in biology. He attended medical school at the Chicago Medical School. He completed his orthopedic surgery residency at Ochsner here in New Orleans. He received additional training in the field of sports medicine at the prestigious Steadman Hawkins Clinic of the Carolinas, where he learned from and worked alongside some of the best sports medicine physicians. He played high school soccer and tennis and college football, as we mentioned, so he knows the game, and working with the Hornets and Saints knows what athletes have to do to compete at the highest level. And it is our pleasure to welcome Dr. Misty Suri to Hello Health. Great to have you with us on the program.
Nice to be here, Tom.
Thank you for being here. Well, I read that you're still playing golf and tennis, so obviously sports have played a big role in your life.
Definitely. Sports has been a part of my life since a young kid, and a lot of orthopedic surgeons and guys that go into sports medicine have played sports throughout their high school, and sometimes, a lot of times in college, sometimes even professionally. And it's a good way to be able to relate to our patients. Now, not all of my patients are athletes, but a lot of them are weekend warriors, and a lot of them are people who work. And so it's good to be able to relate to everybody. I
didn't know this until tonight, but the University of Pennsylvania has 2 football teams. The one that we may see on television, although Penn doesn't make it to big-time television too often. But it also has what's called a lightweight division, where it competes against some of the other Ivy League schools. Tell me about that.
Lightweight football is a league in the Northeast. It's the Army, Navy, Princeton, Cornell, and Penn have teams that participate in this league. And there's a heavyweight division, which is normal Division I football, and then there's a lightweight division where you have to weigh 160 pounds or less. It's regular college football, except it has a weight limit like wrestling. Mm-hmm. And you get a weigh-in 2 days before the game, and it's just normal football.
Looks to me like you could still be playing if you wanted. Although your playing days are probably behind you, right?
I'm getting older now, Tom.
Did you know at Ben Franklin that you wanted to be a doctor? At what point? Because I talked to your mother actually today, and she said that you played a lot of doctor when you were a kid, probably even before you got to Ben Franklin High School. But did you know early on that was something you were interested in? And what led you, and do you think it was sports that led you into the direction in which you ended up?
During high school, I thought always that I wanted to go into medicine, sort of, and you don't really know in high school until you finish. Then I got to college. I actually tore my own ACL, playing soccer in college, and that was early on in college, and I had it fixed by an orthopedic surgeon in Philadelphia, where I was in school. And that guy the orthopedic surgeon that I was treating me was a pretty good guy, and so I kind of got inspired that way. And so I learned about it as a patient first, and then wanted to learn more about it. And that was the ultimate deciding factor as to going into orthopedic surgery.
Ben Franklin is one of our area's top high schools, but it's also one of the top high schools in the country. And you said it was a biology teacher along the way, maybe several teachers, but I think specifically you mentioned one who made science fun and interesting. Tell me about that.
Yeah, it was Mr. Catalano at Ben Franklin, and so thanks to you. Here we are. You know, we all, as we go on through school, we tend to remember and like the subjects that we like the teachers the most in a way, and that's what happened. He made it. It was a tough, really hard class, biology, regular biology, as well as the AP course afterwards, and it was sort of the gateway into the sciences for me.
That's terrific. Well, thanks, Mr. Catalano, for bringing him to us. Well, let's begin by going back to human anatomy class. We know the hip bone is connected to the leg bone, but we're going to need a lot more than that tonight as we talk about hip surgery, arthroscopic hip surgery. So bring us back to that science class, if you would. How's it supposed to work?
It's supposed to work where the hip is basically a ball in the socket. You've got different types of joints in your body. You've got the elbow, which is more of a hinge, the knee, which is somewhat of a hinge, but a little more complicated than that. The shoulder is like a golf ball and a golf tee, but the hip is really a ball and socket. And surrounding that socket is what's called the labrum. And the labrum is a sort of a fibrous cartilage layer that surrounds the ball and kind of helps to form a seal of the ball into the socket. And that's the normal hip. And you can get pathologies in the hip or problems in the hip when the labrum is torn or the cartilage is damaged and it doesn't function as a well-articulating, near frictionless ball and socket.
And we're going to talk about diagnosing it in a moment, but let's talk about what goes wrong. Is it typically wear and tear that is the issue, or is it stress? Is it that the hip is doing something it's not supposed to do, or a combination of both of those things? We don't really know is the answer. The short answer to that question is many times there's problems with development, but they can be superimposed with a repetitive type movement or trauma as one gets older. When you have a ball and socket that's out of round or over covered, as we call it, then there can be a problem if it's not articulating how it's supposed to. Okay. How are most hip problems diagnosed? Am I going to know before you know?
You probably will. You'll come in to the clinic and you'll say, Doc, you know, when I'm getting out of a car, I'm having problems. My hip doesn't feel right. It catches or locks or it's kind of giving out on me. I'm not as strong in my leg as I used to be. Or when I'm playing tennis on the weekends, I'm not able to move quite as quick as before, and so typically we'll use the history of the patient as well as the physical exam, and then it'll be imaging that we need to do afterwards, such as X-rays. Most of this can be diagnosed with X-rays, and sometimes we need to do MRIs afterwards.
Okay. Is there a primary cause? We talked about some of the possible causes, but is there a primary cause of most hip problems?
It's really a problem of when that ball and socket joint is not working properly, and that's really the main issue. Now, whether or not that happens through trauma or through wear and tear over time, that's sort of the secondary issue.
Okay. Next thing we want to discuss is treatment options for hip issues. Now, again, we're talking, most of our discussion tonight is before hip replacement surgery. You need to understand that tonight. Tonight's topic is not replacing the hip, but doing things before you would get to that point. So let's talk about the different treatment options, and one obviously is not operating and the other is. So let's begin right there.
The normal conservative treatments that we do on patients would be rest, anti-inflammatories, and sometimes we even do injections, and physical therapy as well to get the hip strengthened or stretched out, whatever it is the case.
That'd be a steroidal injection or
correct.
Others? Okay.
Correct.